I'm excited to talk today about the Internet of Healthy Things. And this is an amazing time. You know, in 2020, not far off at all, we'll have 20 billion everyday objects around the planet that we now think of as inanimate that will be smart. They'll be connected. They'll be able to sense information from their surroundings. They'll be able to process data, communicate data back to the environment. Early forerunners, things like the Nest thermostat. I'm sure you all know examples of this kind of technology as it's creeping into our environment now. But the question I want to ask today and really think through with you is how that will change healthcare delivery. And I made a bet about a year and a half ago when we started working on this book that it would. And so my co-authors and I created the Internet of Healthy Things based on this idea that this is probably going to be very, very powerful. And so that's what I want to share with you, a high-level view over the next few minutes, and then we'll have a dialogue, and again, I'm happy to sign books afterwards. First, want to give credit to my co-authors, Carol Coleman and Gina Cella. Gina's here, standing to my left, your right. It was a team effort for sure. And we were inspired to write this book for a couple of reasons. The first is I've had now 20 years of experience in the industry. And you can imagine the kinds of changes that I've seen. But I really wouldn't have ever conceived that wearables would be a thing, or that we would have a computer in our pocket everywhere, or again, that our environment would be loaded with inexpensive sensors communicating wirelessly to the cloud. So I thought it was important to call out, first of all, how far we've come and celebrate that, but also to talk about what's left to fix, the holes that are still left, and there are plenty. I do have to confess that in my experience of doing this for 20 years, I've seen a few reproducible business ideas and plans come through a few times. Unfortunately, I've seen a few of the same ones fail over and over again. And so I thought it might be useful to point out some of the things that I think are really important to innovate on, as opposed to having people shoot at targets that I think are either not that relevant or are probably doomed to failure. So those are really the reasons that we came up with this, and it's really been an exciting and fun run. So far, we released in October. It's getting really good reviews, I have to say, and I'm very pleased, and it's quite readable, I'm told. So I hope you enjoy it very much. I'm going to start, though, the journey through this topic by taking you into the future, 5 years, about. So it's now 2021, spring of 2021, and I have just signed up for a new health plan, new benefit, offered by my employer, Partners Healthcare. And it's a trade-off. It involves me giving up a tremendous amount of personal information in exchange for two things. One is I get a virtual health coach, and you're going to meet this individual, Sam. It's not an individual, it's software, in a moment. But I also get a decreased premium cost, and I'm sure it'll come up, if not in the Q&A, in your minds about the privacy trade-offs. That always comes up when we have this discussion. And in my mind, we already make privacy trade-offs comfortably, and I believe that with the right level of security and whatnot, we can make some of these privacy trade-offs. So in this case, I have made that. I've given up a lot of my data for this very rich coaching experience, which you'll witness momentarily. The second thing I want to mention about this is that it's really centered around what I know motivates me and how I respond to motivational cues. And you may find that it's not for you. It's, in fact, very possible, because I know I'm responsive to an authoritative coaching voice. So Sam is built with that in mind. But we all have our motivational triggers. And if you think about this future and what it means to have the Internet of Healthy Things, think about how that could be customized to motivate you, to inspire you to achieve better health. All right, so here we are. We're in, as I said, the spring of 2021. And I'm getting up, and I get a note from Sam in the morning, and it says basically, you're behind on your sleep, your activity level isn't what you promised, you're a little bit overweight, and all of this is a problem because you want to fit into a size 34 waist tux for your daughter's wedding in about 6 months. So get going. Now, I forgot to mention that my daughter doesn't know she's getting married in 2022, but go with it. She allowed me to tell the story. So there we have Sam starting to coach me. Now, he already knows a lot of things. He's really giving me some advice. I can either look like this if I'm not careful, or I'd much rather look like that, like the James Bond figure, right? So this requires some discipline, this requires some effort, and this idea of having an ongoing coach help me with that is what we're really talking about here. Sam has access to a lot of data. These are all data feeds from devices I'm wearing or have worn in the last 6 months. This is not futuristic at all. And that's another important comment I want to keep hammering home, is this is not pie in the sky future. All of the data that we need to make this happen is available now. Some of it is in the form of wearables, others in things like location tracking on your phone, your mobile purchasing data, etc. And it's all really available to be able to do this. There are some pieces to fill in, and I'm going to talk about that. But it's not really too far in the future at all. So I go about my day, and very soon, and you're going to be introduced to Sam here momentarily, I'm out for lunch, had my meager lunch of hummus and chips, because remember, I'm trying to lose a couple pounds. And I'm just out walking, and I'm heading in a certain direction when Sam comes through. And I guess the audio's not going to work here. I'll read it for you or paraphrase it. Looks like you're on the way to the bakery. Better not have that cookie. Not a good idea. Maybe instead have a glass of red wine for dinner. Sam knows me well enough to know that I would have a couple of glasses of red wine with dinner anyway. So this was a good thing, and it steered me away from the idea of having the cookie. So I'm back in my office, and at the end of the day, one more message comes through from Sam, and it says, have you thought about taking up swimming? You're just 2 blocks from Boston Sports Club. And I've noticed that there are several people in your social network that are planning on joining for swimming. You could form a swim team, you could do some competitive things. What do you think? Think it over. Well, guys, I haven't really done swimming of that type since I was in college, so I start to ponder this, but the key here is then in comes a message from my daughter who says, hey Dad, I think swimming would be great for you. As a matter of fact, I'm happy you didn't take the cookie for lunch, and you're going to look great in your tux at my wedding. So you can see how this all comes together to be a very, very immersive, personalized environment fed off of these data feeds. So I would, again, propose to you that it is not that far in the future. But now that you have the idea in mind, let's think about what it takes to put it together, and where are the gaps. Some of the characteristics of this future, well, it's going to be automated. It's going to be contextual, like that's really important. Sam knows that when I walk in a certain direction, I'm likely going to that bakery. Also knows that I'm 2 blocks away from Boston Sports Club. Very, very easy data to get, but again, very highly contextualized. Motivational, as I said, built around what I know motivates me. Empowering, because I get the choice, and it's, again, built around something that I want to do for my own life, not, and I'll come back to this, not because my doctor's telling me if I don't lose weight, I'm going to have a heart attack. And then finally, there are incentives involved, and I talked about that. I'm giving up some things, but I'm also getting a big discount in my health premium. So how might we get there? What are the steps? Well, I break it down into 3 areas of innovation. And again, this is all covered in more detail in the book. The first is this idea of data aggregation, normalization. And then there's some, of course, there's some opportunity for new sensors, new things in the Internet of Healthy Things, of course. So we're going to go over each 3 of these in order. But the idea of normalization, simply put, is that the example I like to give is that I have a Withings scale. You saw a picture of that data earlier. I carry a Fitbit, so I know my weight, I know my calories out. That's pretty easy. If I'm meticulous and put my diet into an app like MyFitnessPal, I can get calories in. And I can even display those three numbers because they all make APIs that interconnect now, but they don't really tell a story. They don't really say anything about why one changes one day and the other doesn't, or what that means, or how that can improve my health over the long run. If any of you have studied this, know that if you walk a couple of thousand extra steps a day, it takes probably a year on that if you do nothing else to lose a pound. So some context would be really helpful. The data doesn't really have that now. It's just numbers. It's just numbers. That's a huge opportunity. That's a huge opportunity for any company that can harness all of those consumer wearables and tell us a story about ourselves beyond those numbers. Because the early adopters, the people that helped Fitbit go public, they're all quantitative people and they all like numbers. The vast majority of us are not. So there's an opportunity there. Some of the new sensors, I like to talk about Muse. Muse is one example, there are many. Muse is a wearable that has a EEG worn wearable that does an EEG, but of course that's, unless you're a neurologist, that's kind of boring. So instead it tells you about focus, and it's used as a tool predominantly these days for mindfulness and meditation. So I like the example because, as I said, it's not the numbers that are important here, it's what you can do with that to gain insight about your life. There are other examples. Spire, senses respiration, but it tells you about stress and focus, etc. There are a number of them coming on the market. So I would say look for that wave of wearables where the reporting out isn't a number, but it's an insight. They're coming and they're going to be really important for us. Proteus takes it to a whole nother level, and I guess many of you here, because it's a very enriched crowd, have probably heard about Proteus and their implantable chips that go into medications. These are going to be literally on the market soon for things like statins and lisinopril and medicines like that, where I will be able to track real-time adherence. This is not pharmacy claims, this is not whether I opened a smart pill bottle, it's real-time adherence based on a system like this. Think about that when you think about healthy things and how that's going to change the world. So lots and lots of interesting new companies that are harnessing these wireless signals to really tell a story about our health that's deeply personalized and individualized. Lots and lots going on there. And of course, there are business opportunities remaining. Now, I haven't said much about our relationship with Intersystems. Partners enjoys a very long and healthy relationship with them. And these three areas are all areas where they excel. The first is normalization. And as I said, that's not been figured out perfectly yet. There's an enormous opportunity there. I mentioned that. Frictionless data capture is one worth just stopping and reflecting on for a minute. I think it's fascinating that people will pair and repair a Bluetooth headset, but they won't, if it's a health sensor and it stops working, they throw it in the corner. I don't know why that is, but it's very reproducible. Patients, I guess because, again, maybe we're reminding them that they're sick. That's a problem, by the way, that we're trying to solve, is why this stuff is not as exciting as a Bluetooth headset. But my point here is we have to make it easy. A lot of our patients are a little bit nervous about downloading and installing an app. Can we make it so that maybe you take a picture of a QR code and it just all happens? All of a sudden the app's there, the device is connected, and you're flowing data into our electronic record. I think we can, but today people are really happy about, for instance, low energy Bluetooth, which is a triumph, I agree, but it's just not nearly as, we need to get better at that. We need to get much better at that. And then finally, integration. Again, another thing that Intersystems excels at. Integration of PHRs, EHRs, and the like. Very, very, very important. All right, so once we know all these data points about you, and they're going to get more and more complex, and again, you're building a unique phenotypic roadmap here, we have to do the analytics in the middle. And analytics is all over this meeting. It's a hot topic everywhere in healthcare now. People are really, really embracing how big data can help us do risk stratification and predictive modeling and what have you. And we're doing pretty well. But I would argue if we're going to go into the scenario that I alluded to earlier with my virtual friend Sam, we're not there yet. We're not good enough. Let me share a couple of state-of-the-art examples that illustrate this. So, what you see here are a couple of quotes from people that I interviewed for the book. I'm going to focus on the bottom right because I don't really want to read my slides to you. And Nick Van Gore, who's a friend, and he was joking when he said this, but I think it's telling of how we think about big data. The magazines you read, whether it be Runner's Daily or Barbecue Daily, tell us a lot about you. And indeed, that's true. Indeed, that's true. And we can even segment people according to how they do reading like that. But it doesn't take it down to the individual level. And I might say there might be some very healthy people reading Barbecue Daily, and if we signal them that we think they're unhealthy, they're going to be offended. So we can't just do it that way. Here's another example from the Wall Street Journal. This was about a year ago, and it was really published as a leading edge, state-of-the-art use of big data for a pharmaceutical company that was recruiting patients for an obesity trial. And let me just share with you some of the insights that they come up with. People who have large cable packages tend to be more overweight, right? People who take active vacations like skiing tend to be healthier. Can't we do better than that? I mean, really, that's state of the art. And I would say that if we're really going to do this unique individual messaging to keep you inspired to be healthy, we need to get it down to the individual level. So the business opportunity here, stated quite simply, is we got to go from this model where someone says 100 people like Joe read this book, so maybe Joe would like to read this book, and take it down to the individual level so we know exactly what we, and like I said, those things in the Internet of Healthy Things are going to enable us to have that unique profile of you. I think we can do this. I don't think this is a problem that needs new technology, but we are losing a lot of talent to companies like Google and Facebook and to Wall Street. We need to draw them into healthcare to help us solve this sort of problem. Now, engagement. So there's a biblical quote, and I never remember it, but it's something like, if I know all these things and yet without love, there's nothing. In this case, if I know everything about you, and I've been able to do this magical data analysis so that I have a unique profile of you, but I can't message you in a way that's compelling, it's all a waste of time. So the engagement part is really important, and that's deep into psychology, it's deep into understanding you as an individual. As I said earlier, I built this scenario about how I know I'm motivated. We need to be able to figure out how each one of you is motivated. There's a whole chapter in the book on this topic, and it was inspired by my listening to a story on NPR about 2 years ago about how people check their phones 150 times a day, and then thinking, why can't we get people to do anything healthy even once a day? What makes mobile phones so addictive, and can we make health addictive? So you'll see there's a chapter called Try a Little Dopamine, because we're really experimenting with what is it about that environment that's so addictive. And again, can we turn health messaging into something that's much more exciting? Like I said earlier, those of us who are healthcare providers, we're all trained that if we scare you, somehow that will make you change your behavior. If we beat it into you that you're going to have a stroke if you don't lose weight, or you're going to lose a leg, or what have you, that stuff doesn't really work. So we got to move on to a different messaging scenario. This slide illustrates 3 strategies and 3 tactics, and because of time constraints, I won't drill into all of them. I'll just pick out a couple because SAM was designed in a certain way to take advantage, and really the top 3. So the first one about life. Remember, SAM was constantly reminding me that I wanted to fit into a pair of pants that were 2 inches smaller in my waist than what I'm currently wearing, right? So that's making it about life. The second one is personalized, and once again, taking all of these data points in. Sam had a very, very, very personalized view of me and was able to message me in a very contextual way. And then lastly, the social piece. It was really the knockout blow, if you will, when my daughter sends me a text quoting all the things that I've done from that day or didn't do and reminding me that I need to look good for her wedding. That's the social piece. So they're all really powerful, they're all really important, and they're available to us now as tools. So we got to use them as opposed to, like I said, sort of lecturing people about the fact that they're sick and they need to get better. A couple of companies that have done a nice job of this, and again, there are many. I chose to highlight a couple of them in the book. Omada is one, and I take my hat off to them for a number of reasons. First of all, they're successful. They've done a very nice job as a business, but they've tackled a problem that I think is really worth focusing on for a minute, which is the diabetes prevention program. Capturing people who are not yet sick and motivating them to stay healthy. And that's a hard problem, believe me, especially with that demographic and that problem. And they've done a good job of it, once again, combining the use of sensors and coaching. So I tip my hat to Omada and their success. And I mentioned WellDoc simply because, again, they were there from the beginning. They started their program before the smartphone. Their first versions were on feature phones. And they've done everything right, from the FDA approval stage to the getting insurers to pay for it. But you have to realize they were only able to do any of that because they had engaged patients from the very beginning. They had this way of interacting with patients that was engaging, that translates into better outcomes, and they took those better outcomes and achieved their business results, business objective as a result. So I tip my hat to WellDoc. Now, what can we do left in engagement? Well, lots and lots and lots. Lots of opportunity here. The first has to do with design. Healthcare design is terrible for the most part. Most software that we use for healthcare is terrible. I was talking to someone earlier today about patient portals. Wonder why the adoption isn't so great. How many of you think that your patient portal is anything exciting, right? We give people information that makes no sense in an environment that's poorly designed and wonder why they don't come to it. There's so much around us where companies are using good design, psychologically motivated, tested design to get us to draw into things like games and Snapchat and all kinds of things. We should harness some of that for healthcare. So consumer-centric design, very important. If you're a designer or you know designers, coach them to come into healthcare and help us solve this problem, because we got a long way to go. I mentioned already fitting into everyday life. I can't emphasize that enough, how we've got to make short-term goals for people so that they're achievable and they're meaningful for their surroundings, as opposed to this long-term notion that I might lose a year off my life or have a complication 10 years down the road. We just got to stop that and move on from that. Personalization is something I mentioned earlier, and I can't emphasize that enough as well. And then finally, something called the sentinel effect, which we really haven't talked about, but that social piece that I talked about with my daughter is sort of related. That is to say, in the scenario in the back of my mind, if I know that I really want to please her for her wedding, and she's got all this data coming at her fingertips as well, it's going to up my game. I'm going to behave differently. And we use it in healthcare delivery because we take advantage of the doctor-patient relationship. And we know that if your doctor's, typically for most of us, if your doctor's office is watching your info and your data as it streams in even a cursory way, that changes the way we behave. And so we like to take advantage of that because we have that relationship. And we build strategies around that sentinel effect. So I'm going to take you back now to the same futuristic place I was. It's the end of that long day, and I've had many messages from Sam. The last message that comes through is from my doctor this time, and it basically reviews the day, and she says, well, you're doing okay. You're not terribly sick, but you got to decide. You're going to work on sleep. You're going to work on activity, because we know from your history that if you try to do both, you'll fail. So choose one and get going. Again, this is all automated. This isn't actually my doctor at all. It's coming from software, probably from the EHR, but it feels very personalized. And that's the end of my story. And again, that's sort of a high-level trip through the Internet of Healthy Things. I want to leave you with one thought, though, and that is, I would say it's not just kind of fun or cool or wow, isn't that gee whiz? This is, to me, not an option. We have to do this. I don't see another way to fix the myriad of problems we have in healthcare. First of all, we have to give all of us the tools to make ourselves healthy, which this can do. And secondly, we have to start rethinking how we're accountable for health and motivated to be healthy. And again, this set of tools can help with that as well. So I would hope that you would all be motivated and inspired to contribute to building out this future in some way, because it's really important that we get it right.